right. What is the most appropriate management for this patient? 35-year-old man, history of high myopia. Presents the ED, sudden onset of floaters and a shadow in the peripheral vision of his eye that started this morning. Denies any pain, redness, discharge. Patient's medical history is hypertension, controlled with medication. Okay. Examination of visual acuity 20/30 on the right, 20/20 on the left. Dilated fundus examination of the right eye reveals a retinal tear at the superior temporal quadrant with surrounding subretinal fluid. Oh boy. Okay. What is the most appropriate management? Well, if he has a tear, I don't know that much about ophthalmology.
Something I don't
Had the
either. So
floaters, he had the shadow in his periphery. But just based on this question, if there's a tear with fluid, like we were just talking about before, you might want to do something like more invasive as opposed to like topical corticosteroids, or you're not going to want to start a drug that could take a little while. um I don't know what a pneumonic retinopexy is.
mhm.
um but does he have cataracts? Cataract, what am I thinking for cataracts? Are cataracts like tears like that? I don't think so. I thought cataracts take like a long time to develop and you sort of watch it and they're not emergent. Um, hmm, I think he's like losing, if it's sudden and he has the shadow and stuff. I don't know what that pneumatic, I mean, pneumatic thing seems like a pressure thing to me. Um, I don't know. Yeah, I would guess that, but I really don't know. I don't think it's a cataract surgery, but I'm thinking it has to be invasive.
Good. Yeah.
Okay.
So exactly, it had to be something invasive, right? And it's usually a retinal, looks like a retinal tear, maybe, right? And so
Okay.
a retinal detachment, right? And so how you gonna do is a retinopexy, which I mean, I think it just means that it tacks it down somehow, right? Um,
Okay.
but let's talk about the rest of it, right? So, cataract surgery, right? Patient is retinal detachment, not cataract. So that wouldn't be, even though it's surgical treatments for the wrong diagnosis and wrong procedure.
Okay.
So that's not going to be the
Hmm.
right answer. And then the rest are, these are all medications, right? And so, like
Right.
you said, if you're thinking it's an acute issue, you want to be a little bit more aggressive here. So good.
Okay.
Involves injecting a gas bubble into the vitreous cavity to tamponade the retinal tear and promote reattachment, which is really
Pretty
cool. Never
interesting.
knew anything about
Yeah.
it, but retinopexy, right? Whenever you see pexy, right, is some kind of like repair. So
Okay. Oh, okay. That's what that means.